This morning, medical experts are warning about a norovirus outbreak hitting several states. The CDC reports more than 90 cases confirmed in the first week of December alone. That's more than double the cases we've seen that same week over the last 3 years. NBC's Shaquille Brewster is joining us now with more on all of this. So why now? Why are we seeing a big surge, Shaq?
Well, Anna, it's around that time of the year where you're seeing people gather with family and friends. They're sharing food. Just think about how so many people are planning to celebrate the new year tonight. And the problem is we're seeing this clash essentially with a spike in the spread of norovirus. Fortunately, doctors say there are some simple steps that you could take to prevent this from spreading further.
This morning, a holiday health warning as cases of the norovirus surge.
Norovirus decided to be our last little Christmas gift.
New data from the CDC shows an increase in outbreaks, with 91 reported in the first week of December across 14 states, more than double the number for the same week over the past 3 years.
Is there any reason why we're seeing this rise?
Gathering together, especially this time of the year, and all the traveling we're doing, that's causing the increases.
The highly contagious virus, commonly referred to as the stomach flu, can cause days of vomiting, gastrointestinal problems, and fever.
I promise you, you do not want this.
The recent rise comes as multiple states reported new infections in December. In Minnesota, health officials say the number of outbreaks are twice what they usually see. California officials also investigating an outbreak involving 80 people who became ill after eating raw oysters at a Los Angeles food festival. And on 3 different cruise ships operated by Holland America and Princess Cruises, more than 300 passengers contracted the virus. Norovirus can be spread through direct contact with an infected person, touching contaminated surfaces, or eating contaminated food.
If you have been sick with this, I'm sending you all my love because it's no joke.
Now, with millions expected to gather for New Year's Eve celebrations, health experts say it's important to take precautions. Wash produce thoroughly, don't share utensils, and don't rely on hand sanitizer.
You know, we all have this around the house, the hand sanitizer. This does not work very well for norovirus. You need to wash your hands, that 20 seconds we always talk about.
Dr. Torres went on to say that if you are not feeling well, the best thing that you could do tonight is to, unfortunately, just stay home. And remember, with the norovirus, even if you're feeling better, you can still be contagious for up to 2 weeks after those symptoms first appeared. So make sure you keep track of when those symptoms occurred in order to help keep other people safe. As we know, this is a time when it's not just norovirus. You're also talking about COVID, RSV, and flu that's on the rise, Anna.
Boy, sounds pretty miserable. Stay healthy, my friend. Thank you.
Yes, you too.
Joining us now, infectious disease physician and founding director of Boston University Center on Emerging Infectious Diseases, Dr. Nahid Bhadillia. Thank you so much for being here, doctor. As Shaq just laid out, norovirus isn't new this time of year, but these numbers are pretty staggering, almost double what we've seen in recent years. How do you explain it? Why so much worse this year?
Yeah, Anna, I want to begin by underscoring what Shaquille said, which is that this is highly contagious. I mean, it takes very few viral particles to transmit this, and this kind of runs through like wildfire in communal living spaces and nursing homes and cruises. This is why you're seeing such a rise. And within families, it becomes harder, too. So that transmissibility, the contagiousness adds to it. But if I were to guess, I think there are a couple of reasons that I can imagine why. One, there's always a surge in the winter. It's possible that we haven't seen as high numbers in recent years because we weren't mingling as much for a few years during the pandemic. And, you know, now we've changed our behaviors. Potentially, we're not being as vigilant as we should be with washing our hands, disinfecting surfaces. And second, you know, maybe because we haven't had as many outbreaks, potentially we don't have as much immunity to some of the strains that are transmitting. Those are some of the thoughts I could think of, but we don't have a definitive answer except for the fact that it's very contagious, but very easy to protect yourself if you keep your hands clean and keep the surfaces clean.
I know, we're just seeing all that video, people washing their hands. Any other advice that you can offer people trying to keep their family safe during this surge?
Yeah, I always advise that during winter months, I mean, if you don't have communal food sitting out in offices or buffets and things like that, right, which is really that shared, it's fecal oral route, unfortunately, awful to say, but it's literally don't wash your hands. But if you're sharing, try not to share food, communal food with those outside your family. And as Shaquille mentioned in the report, not sharing utensils is another way to protect yourself as well.
And with the holidays and these big gatherings also comes the added risk of catching COVID or the flu or RSV. What is the latest on those other viruses? Just how bad is it this year?
Yeah, thankfully we're not seeing as high a rate of hospitalization as death because we've gotten and built up immunity over the years and people have been taking the COVID-19 vaccines. But if you want to stay, particularly if you're somebody who's vulnerable or you have someone in your family, everybody over the age of 6 months should be taking a flu and COVID vaccine. If you haven't taken those vaccines yet, there's still time. The flu season is a little delayed this year, but the cases are ramping up, and so you should take it now so you can be protected for the rest of the season. For RSV, if you are someone who's over 75 or someone who's medically vulnerable between 60 to 75, you should have gotten a dose last year. If you didn't, you should get one this year. If you got one last year, you don't need to repeat it this year.
And as far as those vaccines, like the flu vaccine and COVID vaccine, is it safe to get them at the exact same time? And do we know, is the latest COVID vaccine up to date in terms of the most recent strain?
Yeah, good question. You can take the flu and COVID vaccines together, no problem. And the current booster, the current version of the COVID vaccine was formulated last spring, but it still actually gives a lot of coverage for KP.2, which is the strain that's been circulating at the highest rate in this fall. So still worth it. I would take it because it keeps you from getting more severe disease and potentially end up in the hospital.
Dr. Naheed Bhadelia, thank you so much, and Happy New Year to you.